The free Physiotutors app now and become the best clinician you can be.
Hi, and welcome to this masterclass. I am Max from Physiotutors, and today I'll try to teach you a thing or two about stats and methodology in physiotherapy research. And it appears that muscle strengthening is effective in reducing neck pain. And he takes the win and he goes on to tell his friends of a new effective treatment modality he found. But then there was one skeptic friend that had a few questions. He says, Alex, this is great work, but how are you certain that these effects come from the muscle strengthening that you administered? Let's get into these effects a bit more and what we mean by them. So we have specific effects in the middle column, and these are the effects that you usually think that the treatment has in the first place. So let's just state the neck strengthening that Alex wants to do. This will increase the neck strength and make the patient better. Or muscle strengthening somehow increases the resilience maybe of the neck structures and thereby making the patient better. So the natural history is pretty easy. If someone gets an acute bout of neck pain, he or she will often get better over time regardless of the treatment. So his previous strategy allowed him to witness the natural course of treatment and patient responses, but it lacked the ability to control the external influences. So he understands that he needs to be specific about his research that he has and to get the best results. So he developed a PICO for his question. Now, Alex is onto something here. He sees that it's getting hard to draw conclusions when just seeing the patients and simply writing down these numbers. As Alex examined the responses of two groups of patients to his treatment, he found two more values that could help him analyze the data. And by using these three measures, Alex gained a more comprehensive understanding of how patients in each group were faring, aiding him in evaluating the efficacy of the neck strengthening more thoroughly. And as Alex explored his collective data, he saw that it was shaped a bit like a bell. So this bell curve or normal distribution shows how things are often spread out in a large group. He understands that by calculating this value, he can objectively determine if the results he sees are statistically significant, so he can be more confident in his conclusions. Alex might want to know if having stronger neck muscles will decrease neck pain. And that's fine. Let's say for the sake of this example that Alex already successfully finished his RCT. The p-value for neck pain is 0.01, below the 0.05 threshold, he said. So let's get back to Alex because he found a few quirks with his p-value. Alex did some experiments with made-up data and found a few things. So he had a truckload of data and a tiny effect or difference. As you can see, just 0.1 on the VAS scale. So in both groups, everything is the same except of the sample size. Nobody called you, but sometimes it just looks like it. It's the same way with data. There might be nothing there, but sometimes we'll get a statistically significant result. A small sample size may leave a study vulnerable to overlooking genuine, real treatment effects, whereas a larger sample size strengthens the study's ability to detect the differences. So Alex figured out that sometimes the effects or the lack thereof might be wrong. But what if it is a true effect? How big is the effect, and is it worthwhile in the clinic as a treatment? After calculating this effect size of a study, he notices something he has seen before. So the effect sizes are really useful, but it's still a fixed value without any uncertainty. And by now he knows that's pretty much, again, big confidence interval, more uncertainty, smaller confidence interval, less uncertainty. So after all this trouble, Alex finally has everything he needs to perform his robust RCT and results come in. So that was it for this masterclass. I hope you learned a thing or two. from Alex's story, and if you did, make sure to leave some feedback on our socials. I am Max for Physiotutors, and I will see you in another video. Bye.
Watch the full masterclass for free on the Physiotutors app. Link is in the video description.